Many people around the world are losing their loved ones due to COVID 19, and it's taking everyone by storm. We need to start taking certain measures and precautions for this new disease we have very little information about so far. Hello, my name is Paul, and today I'll be talking about why you should quarantine and stay at home for others. At the moment, COVID 19 is a global pandemic that has no vaccination. Scientists and pandemic experts around the world are vastly researching to try to find a cure to prevent people from spreading this novel virus even more. Although in the United States, which happens to be the epicenter of this pandemic, President Donald Trump has decided to halt funding towards the World Health Organization due to them not acting quickly enough to investigate the virus when it was first emerged in China back in December of 2019. This could cause a huge issue in regards to trying to flatten the curve. According to the World Health Organization, there are over 2.2 million confirmed COVID 19 cases globally and over 140,000 fatalities in only a span of a couple months. These statistics show how serious this issue is and how it can start to spread and affect people in your region. People with weak immune systems and underlying illnesses are even larger at risk. This is why pandemic experts and scientists around the world are saying the best way to prevent spread this virus is to stay at home and start quarantining. The reason why this is the best way to help prevent the spread of this new disease is because it is airborne and easily transmissible through human contact. Practicing social distancing and staying at home orders will stop the cases from rising and rising day by day. Not only are you helping yourself from contracting the virus, but also helping others that might be more at risk. This map here helps shows which states at the moment are following a stay-at-home order, and eventually it will be all 50 states. People have shown to be asymptomatic to the virus and have it, but others won't be and can have a negative impact from it, worst case scenario being death. One COVID 19 positive person can contract up to 33,000 people alone. We need to flatten the curve by quarantining and/or social distancing. Another thing you might think is that staying at home can reduce productivity and can start making you a lazy person or a couch potato, which could happen, but quarantining is also a great time to be able to pick up those new hobbies you've always wanted to learn, or get better at like playing an instrument or learning how to draw, or even spark your productivity by learning at-home workouts or exercising. In conclusion, COVID 19 is a global pandemic with no vaccine. With exponentially rising cases, we need to start taking this matter very serious and consider the realities of what can happen if we do not do the things we are supposed to, like wear a mask, stay 6 feet apart from other people, and just overall staying hygienic. Are we eventually going to start to get bored? Of course, it's bound to happen, but it's something that we need to start doing. There's a reason why they're closing all the beaches, all kind of community parks, things like that. We need to start taking matters to our own hands and actually fix the solution ourselves. The better we start quarantining and staying at home, the more faster this can flatten the curve. An outbreak anywhere can go everywhere. And right now, we all need to pitch in and try to prevent cases both within ourselves and our communities. It's called flattening the curve, a term that public health officials use all the time, but that many Americans just heard for the first time. If you look at the image above, you can see two curves, two different versions of what might happen in the US, depending on the next steps. The tall, skinny curve is bad, means that a lot of people will get sick at once in a short period of time because we do not take enough steps to prevent the virus from spreading from person to person. Most people won't get sick enough to need a hospital, but those who do could overwhelm the number of beds and care teams that our nation's hospitals have available. The flatter lower curve is a much better one, but it will take working together to make it happen. If individuals and communities take steps to slow the virus's spread, that means the number of cases of COVID 19 will stretch out across a longer period of time. As the curve shows, the number of cases at any given time doesn't cross the dotted line of the capacity of our nation's healthcare system to help everyone who's sick. If you don't have as many as cases coming to the hospitals and clinics at once, it can actually lower the number of total deaths from the virus and from other causes. And importantly, it buys us time for university and government scientists and industry to create new therapies, medications, and potentially a vaccine. Another key factor to consider, the doctors, nurses, pharmacists, and technicians, and many other staff who actually work in healthcare, the more cases of COVID 19 there are at any given time, the more likely some of them are to catch it. Whether in the community or at work, once they are sick, they need to stay away from patients for weeks, which means fewer people to take care of the patients who actually need the care. Canceling, postponing, or moving online for our work education and recreation may be inconvenient, annoying, and disappointing. But hospitals need to have enough room, supplies, and staff to care for those who need hospital level care, whether it's for the coronavirus or a heart attack, car crash, broken bone, or anything like that. That's why it's important to listen to public health authorities and leaders if and when they say it's time to change, or how we live our lives temporarily. Flattening the curve is not a long term strategy. It is a short term necessity thrust on the nation by our failure to plan for an inevitable public health crisis and our tragically inadequate response in the early days of the coronavirus outbreak. Our slow initial reaction, especially the inability to initiate meaningful levels of testing, limited our options and committed us to our current strategy. As we contemplate the future systemic changes, we must not lose sight of the insidious role that partisan politics continue to play in our public health policy. My call to action is for everyone to start flattening the curve and maintain their health and well-being while also understanding the importance of quarantining and social distancing. Thank you.